Hi everyone, this is Rachel, and today we're going to be talking about 6 questions for the Nursing Employment Office. So these are questions that you want to make sure that you touch on, or at least find the answers out before your first nursing job. Once again, the information that I'm bringing to you is from this book, First Year of Nursing, or First Year Nurse, Wisdom Warnings and What I Wish I'd Known, My First 100 Days on the Job, by Barbara Arnoldussen. 1. Do you have a new grad orientation program? How long does it last? And how is it combined with regular work hours? So for instance, when I first started as a nurse, I had a 6-week orientation, and that was done before I even started in the specialty that I was going towards or where I was hired for. So once I completed that 6-week program for the hospital, then I moved into on my unit. After that, you're on your own. Question 2. Will a preceptor or mentor be assigned to me for an introductory period, and then for how long? So with my job, after I completed the first 6 weeks of orientation for the hospital, then I moved on to the unit that I was working at, and then I had a mentor, somebody that may not be the same person day to day or week to week, but it is definitely someone, your go-to person that you ask all your questions to. You don't make any movements or do anything without them knowing first and them approving or okaying, and they're your, basically, if you are big brother, big sister type of situation, that's really who you're looking up to for help. Question 3. How much paid time off is there available for training or continuing education credits? These are things that you would want to kind of know about ahead of time. I know that in my experience, there's quite a few different trainings that the nurse needs to know. So CPR training, any above or additional training that needs to be met before you start your job. Those are all things that take time away from your job while you're there, and it would be important to know if your time is reimbursed, or if mileage during a drive time is reimbursed, or if the class is something that you're expected to pay, or if the hospital pays for that. So just make sure you ask those questions. Question 4. Do you reimburse for higher education courses? So I know that there's a lot of nurses that go into the work field and they don't have their BSN yet, and so a lot of those nurses are interested in going back to school and gaining that extra knowledge and extra schooling, and so it would be good to know if any of those costs are covered. Question 5. What is the dress code? So in our field as nurses, nurses could wear white. CNAs were not allowed to wear white. Nurses could wear really any kind of color scrub. It just kind of depends on the institution you work for and the facility and whether they have a dress code. I know other places, nurses wear a certain color, the aides wear a certain color, doctors wear a certain color, respiratory therapists wear a certain color, so that everybody's color coded and you know who everybody is. 6. Are there merit-based raises? That's like done system-wide, or is it raises that are done due to the years of service that you're there? So in the field that I worked at, I think there was a lot of raises that they based on years of experience. Like each year there would be an incremental increase for that, but then also they did do a performance-based assessment, or something like an evaluation where they checked off your skills and made sure that you were doing your job, bringing the values and the core beliefs of the hospital to the forefront and doing what you need to be doing for their institution. So I hope some of these questions helped you. If they aren't questions that you had thought about before going into your interview, these are great places to start. And I wish you the best. Good luck to you in your nursing endeavor and your interviews as you start out into the workforce. Make sure that if you're not subscribed, that you hit the subscribe button, like this video, share it with others who could use it, and we'll see you next time. Thanks for watching.